Hello folks. I'm Dr. Lyle Ashberg, your friendly pediatric orthopedic surgeon and hip specialist, checking in again with a recap of our last episode. And, people say I take myself a bit seriously, so perhaps I should be wearing my funny surgeon hat, or maybe not. All right. The last episode was called Can Get No Stem Cell Satisfaction. And the reason I did that was because I think that a lot of what is being pushed in the press about stem cells, or even what's being advertised by medical clinicians, may be misunderstood, overrated, and perhaps providing promises that we can't really keep. So the first thing I touched on briefly was this concept of orthobiologics, which means biologic substances that we use in the orthopedic realm to treat musculoskeletal conditions, including bone, joint, and muscle and tendon problems. I noted that these include things like stem cells, which may be a misnomer, and we touched on that, why that is, and other things like platelet-rich plasma, bone marrow aspirate, hyaluronic acid, and then some future technologies that are coming out that may be helpful. I noted that the reason that this has become such an exciting and well-funded and, to be honest, lucrative endeavor is because preclinical studies have shown that these biologics may actually help with symptoms and also potentially tissue regeneration. And there's been huge demand for it because the public want a less invasive, non-surgical option to treat their problems. And it falls in the realm of modern medicine, where we're beginning to learn how to use the body's own biology, genetics, proteins, signaling mechanisms, etc., to get healing and improve clinical outcomes. And so this has the potential to be really exciting. Now, the stem cells that we actually are available to us these days by the means that we have to get them are probably not meeting the definition of a true stem cell, and certainly we are probably not getting them in the concentration that may be useful. And I touched on briefly that the mechanism of how these so-called stem cells work relate to some of the substances that are produced that induce healing or symptom modification in the biological setting. And so I spoke about what the FDA will allow us to use and indeed call stem cells. And as I mentioned briefly, it relates primarily to those that are used in the hematopoietic realm, which is the blood-forming units. So to clarify, true stem cells are rarely used in orthopedic treatments or in the orthopedic realm, and a better terminology for these cells may be what are called connective tissue progenitors, or CTPs. And again, the impetus behind using these is that it stimulates the body's own mechanisms to enable healing and symptom modification. I alluded to the fact that the technologies that are used, which include, again, PRP, bone marrow aspirate, and even stem cells derived from fat tissues, are minimally manipulated, have very low risk, that meets the criteria that allow the FDA to approve these to various manufacturers that sell these goods to clinicians. I also briefly touched on the fact that most of the orthopedic societies that are involved in this area of treatment and research, including the American Academy of Orthopedic Surgeons, as well as the American Arthroscopy Association of North America and others, have provided position statements that talk about clinical practice guidelines related to the utility of these substances that are available to us today and their clinical indications. And to be specific, the ones that seem to be most useful include platelet-rich plasma for knee osteoarthritis, hyaluronic acid for knee osteoarthritis, PRP for tendinosis, but the clinical evidence that is available for even these indications which have been approved are mixed. However, I would say that the latest research that is coming out suggests some really promising outcomes, and hence the appeal. Some of the downsides that I touched on are the fact that we have a lack of consistency in how we classify these things, the formula that we need to institute the treatment, and the costs involved, because most of the time this is out of pocket and insurance companies are not covering these treatments. I briefly mentioned some of the future developments in this exciting field of biologics, which include things like exosomes, which are little vesicles that are produced by the cell, which contain all the signaling molecules that result in the ultimate effect. I talked about gene therapy and how this is found to be extremely useful and very exciting, especially in the realm of things like CRISPR, which is where you can actually remove segments of the gene and then insert gene segments that have the potential effect that you're looking for. Remember, though, that this happens in an environment of a whole body system where there are multiple influences, including, but not limited to, things like inflammatory modulators, oxygenation, blood vessels, hormonal influences, age, mechanical environment, and others. In conclusion, I noted that the current orthobiologics that are available probably have more of a symptom-modifying effect rather than a structural modifying effect. The stem cells that we obtained in these various aspirates are very few and probably don't meet the definition of true stem cells. I noted that although this is the case, there is very active pursuit of these orthobiologic treatments because they do hold great promise as a much more personalized and less invasive treatment for a lot of orthopedic conditions, among others. Lastly, I left a slight note of caution that people are engaging in things like medical tourism, where they're going to other countries where stem cells are being cultured, modified, and amplified to try and get better yields. The reason that I left some caution there is because of the lack of regulation and the potential for substantial complications with these methods, and the lack of understanding of what the true formulation, i.e. the recipe that needs to go into the cake being your health, is. So as not to be a downer, I don't want to leave you with the impression that we have no options here. Indeed, the orthobiologics that are available do show promise to help people with their symptoms. And there's a lot of research going on right now trying to figure out what the correct formulations are that will actually result in structural improvement and real tissue regeneration. It's just that the current stem cells that we have in our armamentarium and that are approved by the FDA at this time do not necessarily meet the definition of a true stem cell. With that said, when we're able to amplify these things or delineate exactly what's working and what chemicals or signaling molecules actually do the job, I think we're going to have something really to write home about. So stay tuned. One last thing is I mentioned that the techniques that we do have to treat a lot of these disorders, especially for established arthritis, some of the surgeries, therapies, and medications that we have for this area still provide great solutions to some of these challenging problems and help you get back to living your best life. With that said, I hope that was helpful, briefer, and more understandable. And with that, I'll put on my hat. Cheers!